In Fort Worth, students are learning how to save lives before they even graduate high school. At Texas Academy of Biomedical Sciences, teenagers earn college credit, medical certifications, and a head start in a field that rarely reflects the city they come from.
I chose this school to basically get a head start on, because I want to go into the medical field, so to get a head start on that, I'm graduating with my associate's degree and I got my certification as a patient care technician.
I would also like to get a head start in my my career, saving 2 years. That's going to make a big difference in my medical career.
For many students at TABS, the first spark comes early, from family, church, or a teacher who showed them what medicine can be.
I've always had a passion for helping people, like even since I was younger. I grew up in a church, and a lot of times I saw my mom going to go, help out at the church and do things like that. So that was like one of the biggest things that inspired me.
I just chose radiology technician because it was like the quickest way to get like above like $85,000 a year, and yeah, it was just like the quickest way possible. It was seemed pretty simple to me. So
their reasons differ, but students say one thing matters most: seeing someone like them in the room.
For me, I think it's a good representation for all of us, not just being a black person, but like you said, black and brown people. I think we are setting great examples for younger people that may feel like, oh, we can't because of, where we come from or what we look like and things of that nature. So
I just want to be the first option, the first choice of option. I'm Muslim, so when Muslims hear that another Muslim is a doctor, they always, this guy's Muslim, we got to go. So I just want to be, the first choice of option. I want to help as much people as possible, especially, people like me. So, yeah.
For many TABS students, the road isn't easy. They work long hours, juggle certifications and college classes, while still being high schoolers.
Well, one thing that I personally have dealt with is procrastination. Procrastination and laziness. Like, a lot of the times, I find myself, doing just the bare minimum.
Like he said, procrastination is like a huge issue amongst people our age, but I think again we know how to manage our time. As a person of color, sometimes we have to face systemic barriers that have been put in place by people that came before us, and sometimes we have to work twice as hard to get the same level of respect as people that aren't the same ethnicity or skin color as us.
At TABS, that support comes from both sides of the classroom. Former nurses, doctors, and industry leaders who see their younger selves in these students.
Not everyone wants to go to the hospital. It's not fun. So they're there to trust somebody, and you want that person to be you.
We need doctors that listen. We need all sorts that are the kids, the elderly, our older population. We need everybody to help out in healthcare. It takes everybody. And I think they're getting it. I think they're really getting it, and I think they're really driven to want to be that person that helps.
The goal isn't just to raise graduation numbers. It's to change Fort Worth's medical workforce, one student at a time.
One wants to see someone that looks like them, their culture, those types of things are important to people. If you go into a doctor's office, they don't speak your language. Sometimes there are cultural things that, I could not think that's a big deal, but I could say something and upset somebody. And that is not what we want. So that's why we want to increase representation in the different areas to help both men as well as, people of color in the medical field.
Their careers will take years, even decades, to build. But the first steps start here, in a classroom overlooking downtown Fort Worth.